So what I will do is to introduce Larry Genstil, and I can say my friend Larry Genstil. He's a psychologist with a master's degree and a PhD from the University of Southern California, and he's originally from Los Angeles. He has lived in Israel since 1986 and has worked for many years with people with Prader-Willi. In 1993, Larry founded and directed a PWS group home from Israel. And since selling in 2020, he has been retained as a consultant. He has also been the psychologist at the multidisciplinary team at Shara Sedek Medical Clinic in Jerusalem from 1996. So he's well experienced. And Larry has served for many years as a member of the Professional Provider Caregiver Board of IPWSO. And this is the thing we learned each other. And I really enjoy that he will make the presentation today.
Before I start, I want to say I've presented in many places many times, and I always have the dilemma to present basic or for people that have a lot of experience, and I never have found a solution. So for some of you, I know some of you, for some of you that are experienced, you're not going to learn too much, unfortunately. For those of you who are beginning, hopefully this will give you a basis. So anyway, let's go. So you can see the topic, managing behavioral issues of the child with Prader-Willi syndrome in school. The behavioral issues are social skills, behavioral issues, food security, and visual versus auditory learning. Those are the main issues that we'll deal with today. In terms of behavioral and social skills, the Prader-Willi child learns social and behavioral skills differently than many other children. But a lot of children in special education need to learn differently than normal children can learn by just observing other children and so on. They need to be taught. PWS children need to be taught specifically. And one of the ways that we do this is to discuss a skill to be learned, which could be waiting in your turn, carrying on a conversation, trying to reduce the impulse to have a tantrum or do something else. So discussion of the skill to be learned, demonstrating the skill via role playing. I'm a big fan of role playing with video feedback. Asking the child to role play the skill back with filming, if possible. Now with cell phones, it's very easy to film. When I first started doing this, we had these huge video cameras that were very unwieldy, but they worked. Then give feedback on the child's performance. Usually we ask the child to give his own feedback. Then behavior rehearsal. He has to practice the new skill again and again and again in order for it to become part of his behavioral repertoire. And then reinforcing the continued use of the new behavior. That's pretty much how we teach social and behavioral skills. And because these things are generally new to them, they usually respond impulsively. So when we're trying to teach the new skills, then we really try to reinforce and have them practice a new behavior again and again. One of the behavioral issues that we all deal with, I'm sure, is food stealing. And with food stealing, first of all, we want to limit access to food as much as possible and with maximum supervision. Have children's backpacks in school, if they're backpacks or lockers or whatever, have them out of sight. Empty garbage cans frequently, playground supervision, never leave the child alone. If you leave the child alone, you'll find him looking for food, and they're geniuses at finding food, so they cannot be left alone. The child should be aware that he has no access to food. That's called food security. Guided imagery, we use a lot of guided imagery in terms of what we want them to learn. And with guided imagery, it's a relaxation exercise, and we give them suggestions while they're in the relaxation mode. We give them suggestions what to do, it works, it helps, it's not foolproof, but it helps. And role playing with video feedback. Rigidity and inflexibility is a major, major problem with Prader-Willi. It's just part of the syndrome, a high degree of stubbornness, rigidity, and flexibility. Once a PWS child begins to be inflexible, coaxing him, persuading him, demanding almost never helps. He's like locked in. Distracting sometimes helps. Humor and even tickling can sometimes help. It releases the tension. Sometimes nothing helps, and the best thing is to proceed in class without the PWS child's participation, especially when food is involved. This may help him rejoin the group, may not, but that's the best that can be done sometimes. Doctors Linda Gurash and Janice Forster developed this whole issue of food security. They've presented it many times, and they're wonderful, and I borrowed this with their permission. Food is stress. Food security includes no doubts about what will be provided and when, no hopes of obtaining food outside the diet plan, and no disappointments concerning food. It's obvious that if they have doubts about what they're going to get, there's going to be a behavioral issue. If they have hopes of obtaining food and then get disappointed, there'll be major behavioral issues. No doubts, any possible uncertainty about food must be eliminated as much as possible. Am I speaking too fast? I know not all of you are native English speakers. Okay, I'll just go on. Advanced planning of meals, there should be a diet plan posted along with the schedule of day's events. Place of meals identified, the times of the meals, what the meals will consist of, so the children know. A visual schedule posted for the children to see is important because they're very, very visual. Verbal reminders of these plans, and never use food as a reward or a punishment. Food is just based on the diet plan, period. No hopes, that means no opportunity and no chance to get food outside the diet plan. Food control, so they have no access. Well-trained school staff. And that's a problem. In Israel, we have a problem in that there might be one Prader-Willi child or two in a school. And so training the entire staff is very difficult, but it's important because if the staff knows how to handle these behaviors, it works much better, of course. Caregivers must avoid saying anything that could create doubts or hopes. Matter-of-fact adherence to the plan in the face of manipulation, pestering, whining is an essential skill. They will pester you again and again and again. The presence of these behaviors, the whining, the pestering, the manipulation, that they indicate that food security is not yet achieved. No disappointments. Managing expectations prevents disappointments. Disappointments are a major source of behavior problems. Food control. All food needs to be locked such that there's no access to food or money. Supervision is mandatory. Even the lowest functioning in Israel know how to use money to buy food. So money is also very, very important to be controlled. Management of the physical environment is needed to achieve no hopes and to maintain weight. Food security is a psychological state of the individual. It is food security that improves behavior. Visual versus auditory processing. Auditory processing is usually weak in the PWS child, not with everybody, but it's common. Thus, any communication that is all verbal will result in partial processing and often will lead to behavioral issues. The PWS child is often very verbal, so we think he gets it. But verbal conversations only, if they're only verbal conversations, they have limited use. Only part of the verbal conversation is processed among many of these children. Often the child's imagination fills in the missed content of the conversation, and we know where their imagination takes them, obviously. Often compulsive questioning is a result of only partial understanding of what was said. They'll ask the question again and again and again because they didn't get it. Verbal memory is less acute than visual memory. Visual processing in the PWS child is often above the average of a normal child. They're very visual. All classroom activities should have a visual component so that the PWS child can comprehend everything. Other special children also may be better visually than auditorily, and thus for all pupils, having a visual component to all learning is helpful. All communication and learning need to have a visual component. A visual component communication can prevent behavior problems as a child processes everything. And the examples of visual components, sign language. In my group home many years ago, we had a deaf girl, and she taught all of a sign language, and the Prader-Willis were so attuned visually, they picked it up very quickly. I'm very auditory, not very visual, and I had a hard time, but they got it, and they continued having conversations with themselves in sign language. Gestures, facial expressions, written communication. I write a summary when I have a conversation with them. I write a one-sentence summary, and I give it to them, then they get it. Pictures, communication via puppets. Puppets are visual. Role-playing, especially with video feedback, then they see themselves. All of these visual components to communication help the child get it. And then the constant questioning goes down, the behavioral issues go down because they understand what's being communicated. Basic principles of behavior management. Behaviors can be observed, seen, heard, etc. Behaviors can be counted or measured. Non-behaviors cannot be treated in the same way. Feelings, thoughts, ideas are not behaviors and do not respond to behavioral treatment as in the same way. Some of their emotional situation can be improved with behavioral treatment because they're getting reinforced, but the idea is to improve behavior. All behaviors may be understood via functional analysis, ABC, antecedent, behavior, and consequence. The antecedent of the behavior needs to be defined, usually precedes the behavior and often causes it. There are some behaviors for which no antecedent can be identified, but most behaviors have an identified antecedent. The behavior itself, that's the B, ABC, the behavior itself usually follows the antecedent and is often caused by the antecedent. The behavior needs to be measured in order to establish its frequency. The C, the ABC, the consequence of the behavior, it follows the behavior and is usually our response to the behavior. Frequency, referred to in professional jargon as the baseline of the behavior, is a measure of behavior before beginning any treatment program. It is important in order to ascertain whether behavior frequency changes as a result of treatment. If somebody has tantrums 8 times a week and we didn't measure and we do something, we're not sure if it decreased because of what we did or just it's just a fluke. So it's important to measure in professional settings like schools and group homes. Simple counting the number of times the behavior occurs per hour, per day, per week might be enough. For behaviors that occur only around certain times of the day, then counting only at those times, like you might have behavioral issues the last 20 minutes or half hour before a meal, it's common, or sometimes beginning of the week or the end of a week. For behaviors with very high frequencies, measuring the time during which the behavior occurs might be sufficient. Then choosing reinforcers. Reinforcers increase the frequency of behaviors. We want the good behaviors to increase. Positive reinforcers increase their frequency by its addition. Negative reinforcers increase their frequency by its removal. And punishers decrease the frequency of behaviors. But the word punisher is no longer considered acceptable. The more common term nowadays is cost. But in behavioral terms, it's punishment. I recommend choosing 5 different reinforcers if possible. All reinforcers have to be attractive to the person so that he can expend effort to earn them. If they're not attractive to him, he's not going to work to get them. One of the reinforcers is always verbal or visual. Some people want only 1 or 2 specific things, and then it is not practical to use 5. When there are 5, the reinforcers can be used non-consecutively, so you just rotate so that no one reinforcer loses its appeal to the person. The person will continue to want to earn that reinforcer. The basis of the behavioral plan, behavioral objectives, state the expected or desired change in each behavior, state the measured baseline, state the frequency of each behavior that is desired. Sometimes it's to reach 0, but that's very difficult to do. And state the time frame in which to achieve the goal. Each step of the plan of intervention is very specific and clear. Intervention at the antecedent level, when we have an antecedent, if we respond immediately, often we'll be able to prevent the behavior from occurring. Consistent, structured, frequent reinforcement when the problem behavior is not exhibited based on the attention span of the person. And then when the behavior, so first we're talking about intervention at this antecedent level, the antecedent occurs, we do something to try and prevent the oncoming behavior. Then we reinforce consistently and in a structured way when the behavior does not occur. Then structured non-reinforcing response when the behavior does occur. And when I say non-reinforcing, I'm talking about even things like talking to the person or even establishing eye contact. We all have seen Prader-Willi people wait till you look at them and then they do something. So non-reinforcing response. The next thing I always say, 3 times more positive reinforcement than criticism. And then consistency by all those involved in the program. We're talking about in school, there are usually a lot of staff people in schools, and they all need to be trained because the Prader-Willi person is an expert at finding the weak link in the chain, and he'll use that person to get his food. Via role-playing, giving each person alternative pro-social behaviors in his or her behavioral repertoire. Intervention at the antecedent level. When the antecedent to the behavior is identified, then its occurrence should elicit a response by staff that may prevent or lessen the severity of the behavior. Usually there are some frequent ways to do this. Set up contingencies so that non-appearance of an undesired behavior will result in reinforcement. Distraction from the issue at hand can be very helpful. Humor is one of the best ways to stop a behavior from occurring if you see the antecedent. If you can get them to laugh, then that reduces the tension, and often the behavior won't occur. When the problem behavior does occur, when the behavior does not occur, ongoing structured reinforcement, unless the person prefers only 1 or 2 specific reinforcers, use the reinforcers consecutively to prevent burnout to one specific reinforcer. If you use the reinforcers not consecutively, then they will continue to be attractive to the person. You won't burn out on any one of them. Always use a verbal reinforcer, verbal and visual reinforcer immediately before the concrete reinforcer. The reinforcers need to be given based on the attention span of the person. This is a real important point. If the person has a 5-minute attention span in a given activity, then he or she needs to be reinforced every 4 to 4.5 minutes in order for him not to lose concentration on the task at hand. If you go for 7 minutes, he's lost concentration, and then we can expect behaviors to begin occurring. If there's no reinforcer before the attention span has gone over one's ability to attend, that's when behavioral problems are expected to occur. Give as little attention to the behavior as is possible. Of course, when danger is present, you cannot ignore the behavior, but if there's no danger involved, then ignoring as much as possible. Use low expressed emotion. Often expressions of stress or anger, they may exacerbate the behavior. And when possible, to intervene without causing harm, then it must be done carefully in order not to increase the intensity and or duration of the behavior. Sometimes if we intervene at all, the behavior gets worse. Each person with PWS needs at least 3 times more positive attention than negative. At least 3 times hearing great, good for you, then stop it and enough. Sometimes this alone improves behavior. With some of our more difficult children, they often hear stop at 20 times more than great, and we just need to work on ourselves and change it. Even if we have to look for things with great attention to find what to reinforce. Behavior changes occur more easily and frequently with more positive attention. Sometimes it is difficult to find behaviors to reinforce, but every effort must be made to recut because this is one way to improve behaviors. Consistency, the limits have to be consistent. People with PWS have a sixth sense about the weak link in the person's life, a pitying grandparent, a school secretary, etc. When everyone in the person's life is consistent with all the limits that have been established, then progress in the treatment plan is quickest. Many behaviors occur to the person with PWS based on the syndrome, on his personality, on the structured program, etc. The low tolerance to frustration is a part of the syndrome. And that means that more pro-social behaviors are often not a part of his or her behavioral repertoire. Therefore, in order to allow his learning of new pro-social behaviors, the best way is via role-playing with video feedback. Ask the person with PWS to role-play a situation that was problematic while video recording. Ask the person to think of a better way of responding in the same situation while video recording. Have the person view himself in both situations and give his or her own evaluations. Which Johnny would you choose as a friend? Which Johnny would you want the world to see? In the beginning, when I start this with any group, there are people that are shy and they don't want to do it. But if they do it 2 or 3 times, they get over the shyness, and then they really role play tantrums, really severe tantrums even. and then they see themselves, and one of the responses I often get is, do I look like that? That's scary. Indeed it is. And that's one of the feedback, that's some feedback that we get with almost every group that we do. They almost invariably choose the more pro-social role when we ask, which Johnny would you choose as a friend? Then the person needs to behavior rehearse the new behavior many times over the next period of time in order for him to include it as his repertoire of behaviors. It becomes part of him. He or she needs to be reinforced every time he or she exhibits a new behavior instead of the old one. That's really important. It needs to be worth their while. They need to earn it, earn the reinforcer by using the new behavior.